A nurse in a rural facility receives a message. Habari Nuru, update Kele's vitals on the EMR right away. She has a smartphone. She has data. She can use WhatsApp, but she hesitates. Where is the data stored? Is it safe? What if she makes a mistake? This hesitation matters. This is not lack of intelligence, not lack of effort. It is digital literacy in action, or the gap in it. Meet Nuru, and in this course, we'll follow her journey. Digital literacy is often misunderstood. Many people think it simply means knowing how to use a smartphone. But in healthcare, it is more than that. It is how we use technology to improve decisions, protect patient data, and deliver better care. And it is not one fixed skill. It is a journey, a progression from basic use to confident, innovative practice. In this episode, we will walk through that journey together, step by step. We call it the Digital Capability Continuum, from literacy to competence to fluency to dexterity. But first, let's introduce this episode. Welcome back to Digital Literacy for the Health Workforce course. Today, we continue with Unit 2 of Module 1 on Introduction to Digital Literacy in Health. This is Episode 3 of our series. Before I continue, make sure you like, share, save, and subscribe to this channel so that you do not miss future episodes. In this episode, we will explore 3 key things: what digital literacy really means in health, how it develops over time, and why it matters for every health worker. Digital literacy is not just knowing how to use a phone. It is the ability to access, understand, use, and critically engage with digital tools to deliver healthcare safely and effectively. It includes finding health information, using systems like EMRs, DHIS2 and eCHIS, communicating safely, and protecting patient data. Digital literacy is not about devices. It is about safe and responsible care delivery. Let's look at Nuru's day. In the morning, she logs into an EMR. Mid-morning, she enters patient data. In the afternoon, she sends a referral update. At the end of the day, she submits reports. She's using digital tools all day, but her confidence is not the same at every step. Sometimes she knows what to do. Sometimes she's guessing. Sometimes she's afraid of making mistakes. The variation in confidence by Nuru is not random. It reflects where someone is on their digital capability journey. So the question becomes, how do we move from using digital tools to using them confidently, safely, and effectively in healthcare? The answer lies in understanding digital capability. As mentioned earlier, digital capability is not a single skill. It is a journey, a progression, a continuum, from digital literacy to digital competence to digital fluency and to digital dexterity. In this course, we use digital capability as the umbrella term for this full journey. It describes everything from basic use of a phone to leading digital transformation in health. But every journey begins somewhere, and in this course, we shall focus on the foundation, digital literacy. At the foundation of the digital capability continuum is digital literacy, basic abilities. turning on devices, opening applications, navigating systems, and simple troubleshooting. At this level, Nuru can use WhatsApp but struggles with health systems. At level 2 is digital competence. This is where accuracy and responsibility begin. As Nuru develops digital competence, she enters correct data, understands workflows, and begins protecting patient information. In essence, she begins to use systems correctly and safely. Then comes digital fluency at level 3, the ability to adapt digital tools across situations. With digital fluency, Nuru adapts, solves problems, and works across systems. Finally, at the peak is digital dexterity. This is innovative leadership. At digital dexterity, Nuru is no longer just using systems. She improves workflows, guides colleagues, and uses data for decision making. Essentially, she is improving the systems. In summary, at the foundation is digital literacy, the ability to access, understand, and use digital tools for basic tasks. Next is digital competence, applying those skills effectively in work, including managing information, using tools, and staying safe online. Then comes digital fluency, the confidence to adapt, combine tools, solve problems in changing environments. At the highest level is digital dexterity, using digital tools strategically to innovate, improve workflows, and lead others. Together, these levels show how digital capability grows from basic use to confident, adaptive, and impactful practice. These are not 4 separate skills. This is a continuous journey, from using digital tools to improving how care is delivered. This is the Digital Capability Continuum. Why does digital literacy matter for the health workforce? Let's delve in. Let's return to Nuru again. One day, she makes a small mistake. She sends incomplete data to the reporting system. The district team uses the data for planning. Medicine supply for malaria is underestimated. The result? Stockouts in a facility. A small digital gap resulted in a real health system problem. In Nuru's case, we see this impact clearly across 4 areas. 1. Service delivery improves. Care becomes faster and safer for patients. 2. Patient safety is strengthened because accurate data entry and privacy protection reduce risk. 3. Data quality improves. This leads to better and more reliable decisions. And finally, digital systems become more effective. Tools like the ECHIS, EMRs, and even AI start to work as they should. Nuru started unsure, with limited skills. As her digital literacy grows, she learns to use digital tools safely and effectively in daily work. She then becomes digitally competent, using tools confidently and professionally. Next, she develops digital fluency, adapting when systems change or connectivity drops without disrupting care. Ethics guides her practice throughout, protecting patient data and logging out after use. In a critical moment, she checks the EMR, verifies an alert, and notifies the clinician immediately. She combines tools, skills, judgment, and ethics under pressure. This is digital dexterity. This leads to better care and outcomes. Eventually, Nuru becomes a digital leader in her facility, and by the end of the course, so will you. Before we continue, take a moment to reflect. Where are you on this digital journey? Have there been moments where you hesitated like Nuru? And how might your digital skills be affecting patient care today? Now that we have cleared the conceptual ground, we'll get practical, exploring the specific digital devices used in health settings and what it really means to use them well. Till next episode, goodbye.